Hello, and welcome back to Understanding Depression, the podcast where we explore the real stories, science, and solutions behind mental health. I'm so glad you're here today, and if you're tuning in because you or someone you care about is navigating depression, I want you to know you are not alone. Today's episode is called How to Treat Depression, Therapy, Medication, and Beyond, and we'll be diving deep into the different ways depression can be treated, from traditional therapy and medication to newer emerging approaches. Grab a cup of tea, take a deep breath, and let's walk through this together. Depression is a complex condition. It doesn't have a one-size-fits-all solution because depression itself looks different for everyone. For some, therapy alone brings relief. For others, medication is essential. And for many, a combination, along with lifestyle changes, offers the best path forward. Important to remember, treating depression isn't about snapping out of it or just thinking positive. It's a legitimate medical and emotional journey that deserves patience, compassion, and evidence-based care. What is psychotherapy? Psychotherapy, or talk therapy, involves meeting with a trained mental health professional to explore thoughts, feelings, and behaviors in a safe, confidential space. It's not just about venting, it's about learning, discovering patterns, and developing healthier ways of coping. Major types of therapy for depression. Cognitive behavioral therapy, CBT, helps you identify and reframe negative thought patterns. Interpersonal therapy, IPT, focuses on improving personal relationships and social functioning. Psychodynamic therapy explores unconscious processes rooted in past experiences. Dialectical behavior therapy, DBT, combines cognitive behavioral techniques with mindfulness strategies. Acceptance and commitment therapy, ACT, encourages accepting thoughts and feelings rather than fighting them. How effective is therapy? Extremely. For many, therapy can be life-changing, especially when it's consistent. It helps people build resilience, recognize early warning signs, and regain hope. How to find a therapist? Start by asking your doctor for a referral. Use trusted therapy directories. Look for someone you feel comfortable with. Chemistry matters. Don't be afraid to try different therapists if needed. Why medication? Depression isn't just emotional. It's biological too. Brain chemistry plays a major role, especially involving neurotransmitters like serotonin, norepinephrine, and dopamine. Medication can help correct imbalances, making it easier for therapy and lifestyle changes to work. Important to know, taking medication for depression is not a sign of weakness. It's a proactive step toward healing. Common types of antidepressants: selective serotonin reuptake inhibitors, SSRIs. Examples: Prozac, Zoloft, Lexapro. These are usually the first choice because they're effective and have fewer side effects. Serotonin and norepinephrine reuptake inhibitors, SNRIs. Examples: Effexor, Cymbalta. Tricyclic antidepressants, TCAs, older, but still used in certain cases. Monoamine oxidase inhibitors, MAOIs, rarely prescribed now because of dietary restrictions. Atypical antidepressants, such as Wellbutrin, which affects dopamine. What to expect? It takes time. Antidepressants usually take 4 to 6 weeks to show full effects. Side effects are common but often temporary. Never stop medication abruptly. Always work with your doctor to taper safely if needed. While therapy and medication are the gold standards, they aren't the only paths to healing. Here are other important treatment strategies: lifestyle interventions. Exercise. Regular physical activity boosts mood-enhancing chemicals like endorphins. Nutrition. Diets rich in omega-3s, leafy greens, nuts, and berries support brain health. Sleep hygiene. Quality sleep is essential for emotional regulation. Mindfulness and meditation. Studies show mindfulness reduces depressive symptoms significantly. Social support. Staying connected with loved ones can buffer against depression. Brain stimulation therapies for treatment-resistant depression. Electroconvulsive therapy, ECT. Modern ECT is safe and highly effective for severe cases. Transcranial magnetic stimulation, TMS, a non-invasive procedure that uses magnetic fields to stimulate brain nerve cells. Vagus nerve stimulation, VNS, a surgically implanted device sends signals to the brain via the vagus nerve. Psychedelic-assisted therapy in clinical trials. Substances like ketamine and psilocybin are showing promise for rapid relief of depression symptoms, especially for those who haven't responded to traditional treatments. Important. Always pursue these treatments under professional supervision and through legitimate clinical programs. Recovery from depression isn't always linear. You might have good days, hard days, and days that feel stuck in between. But healing is absolutely possible. The most important thing is to keep going. Key reminders. If one treatment doesn't work, there are others. It's okay to need more than one approach. You deserve care and compassion, not judgment. Asking for help is strength, not weakness. Thank you for spending this time with me today. I hope this episode gave you a deeper understanding of how many ways there are to treat depression, and most importantly, that hope is always within reach. If you found this episode helpful, please consider liking, subscribing, and sharing it with someone who might need it. And if you're struggling, remember, it's okay to reach out. Healing is possible, and you never have to walk this path alone. Until next time, take care of yourself, and be gentle with your heart.